What's up, fool?
What's going on?
Chilling. What's up, y'all? Welcome to an episode of Foos Story of the Week.
In the hospital, we see a lot of crazy things. Everyone who's worked in the hospital has seen like 100 stories. They stuff always happens. But in this episode, this is our first time doing this. But basically, we want to share some of those experiences with you guys, just so you guys get a sense of like what's going on in the hospitals and stuff.
Yeah, that's right. So I'll go ahead and start real quick with a story of that I saw this week, which was pretty crazy. I saw a man with uncontrolled hypertension for years that he knew he had hypertension, but he never continued to get care. And he unfortunately came with a brain bleed into the hospital. So, moral of the story is, he could have prevented that if he got attention and blood pressure medications or got it more controlled earlier in the whole process. So make sure you guys, if you guys have a loved one, to go get care.
Like, what kind of brain bleed was it?
So it was actually a hemorrhage. So, when you have uncontrolled high blood pressure for a long time, your vessels tend to really expand, and that pressure causes, a brain bleed. Think of like a balloon expanding and expanding. Eventually, it might burst, and that's what happened to him, unfortunately, in his brain. What about you, fool?
Actually similar to that, but it wasn't from this week. I think it was my first week on neurosurgery rotation. I saw the same thing. It was a guy who started bleeding from his head, and it was called a subarachnoid hemorrhage. Subarachnoid hemorrhages are super dangerous. Basically, same thing. It's like a balloon. It's actually called. There's like these little aneurysms that can be like creating in your brain, which is like little balloons. Like your arteries are kind of ballooning up, and then eventually they can burst, and then that causes that hemorrhage, like he said. And it was crazy because we had to do an emergency surgery on him. We had to first drill a hole through their cranium. It's called a burr hole. We did that, and then rushed him to the OR. Took the whole skull, the cranium, took it off, and opened up the brain, and then went deep into the brain until we found that little balloon that we were talking about in the artery, and we had to clip it. And that's what we had to do to stop the bleed. And it was just crazy seeing this person there with his brain just exposed. Crazy.
Did it save his life?
To be honest, I wasn't there long enough to see if he was able to live. The prognosis, which prognosis means like basically how likely they are to continue living, is pretty poor with the subarachnoid hemorrhage. He was still alive when I was there. Like, we'd go check up on him. He was still around.
Oh, good.
But I don't know how he, like the long-term thing, like if he was able to survive that or not. But, also, this is also like the highest risk factors are, hypertension and, other things that we can definitely have some control over.
Definitely, yeah. So like Irvin said, that story is kind of crazy and scary, and really what a risk factor means is just something that can cause it. So the number one thing that can cause something like this, what we talked about, is hypertension. So like we mentioned, encourage a loved one or yourself, to go get, taken care of for if you have, high blood pressure and like that. It can lead to serious health effects, and we wouldn't want any of you guys out there to be, suffering from any of this. So,
and one really important thing about high blood pressure is that it's a silent killer. So you might be feeling totally fine. Like, I'm sure this person probably was feeling like they're just chilling there, and that's why it's called a thunderclap headache. That's what they describe the symptom as. It's basically you get a crazy headache that hurts so bad. It's usually the worst headache that these people have ever had in their life, and it just comes out of nowhere. Nowhere.
That's crazy. Yeah, no, we would definitely don't want to be dealing with something like that. Yeah, thanks for telling us, fool. Well, that's today's episode of Food Story of the Week. Thanks for stopping by and, listening to us for this week. Stay tuned for the next Stories Week.
And let us know in the comments anything you guys want to hear about. And yeah,
We'll
pretty
talk
much
about
that.
it.
Yeah, we'll talk about it. Yeah,
Definitely.
exactly.
All right, y'all.